Hi, I'm Dr. Randy Martin. I'm pleased to be joined by Dr. Jeroen Hendricks. Jeroen is in Maastricht, the Netherlands, and he's got a really fascinating subject. You know, atrial fibrillation is a giant problem in this country and worldwide, and his group really looked at specialized atrial fibrillation clinics and the impact they would have in possibly reducing morbidity and mortality. So, Jeroen, thank you for joining me. Tell me a little bit about these specialized clinics.
Yes, please. Well, what we did is we developed an integrated chronic care program in terms of a specialized atrial fibrillation outpatient clinic. So in this outpatient clinic there are three major ingredients which are very important, and that is that there is substitution of care by nurse specialists, diagnostic and therapeutic management according to the evidence-based guidelines, and we use a dedicated software system, and this all is under supervision of the cardiologist.
That's cool. So you have, if patients would come into the clinic and then be analyzed by all of these, and then decisions would be made as to what to do with them based upon that?
Yeah, that's true. And leading in this outpatient clinic is actually the nurse specialist, because the nurse specialist is the first one who is taking care of the patient when they come into the clinic. In the end of this first visit, the cardiologist will join, and he will initiate the treatment and look at the diagnostic, at the diagnosis.
So they're looking at things like rate control and anticoagulation and all those factors.
Yes, that's true.
So the obvious question for me is what did you find with this? If you had this integrated model, what did you find?
Yeah, well, we did a randomized control trial, and we randomized patients into the AF clinic or usual care. And usual care is just the normal care with the cardiologist. So, and our primary endpoint was a composite endpoint, cardiovascular death and cardiovascular hospitalization. And what we found is a reduction in cardiovascular morbidity and hospitalization.
Big, that's gigantic. You know, so many times in this country we have primarily Coumadin clinics or anticoagulation clinics, but not sort of all the others. So do you feel like this integrated model has potential? It sounds like it's very exciting.
I think so, yes. I think it has potential to grow. If I look into the Netherlands, we were the first hospital actually which started such a clinic, and now there are more clinics interested to start also in an AF clinic. So I think there will be potential in the near future.
Oh, I can imagine. I mean, if you decrease morbidity and mortality. And just quickly, if you can, on the software, the specialized software, is it looking at all the parameters of the patient, rates, meds?
Yes. Well, it's a knowledge system, and that means that it needs a lot of information about the patient. So we ask the patient to fill out an extensive questionnaire which evaluates their complaints, the medical history, and these sort of things, and also the diagnostic procedures we put into the software system. From there, the system is able to develop an individual risk profile, and from this risk profile it is able to give a treatment.
To recommend therapies.
Yeah, a treatment advice.
Fascinating, it's fabulous. Well, this sounds very exciting, and thank you very much for joining us. Appreciate your time, and thanks to each of you for joining us. For CardioSource Video News, I'm Dr. Randy Martin.